Hello, and thank you to the Croatian League Against Cancer and the Health Hub for this invitation. I'm Madalina Yamandei, the Executive Director of AllCan International, and I'm delighted to contribute to this forum today during the Bladder Cancer Awareness Month. AllCan is a global multi-stakeholder initiative bringing together patients, clinicians, health system leaders, researchers, and industry with a shared purpose, making cancer care more efficient, more equitable, and more centered on the person receiving it. Today, I want to share a perspective that is relevant to every discussion you will have at this forum, whether on epidemiology, the continuum of care, or access to innovation. It concerns the relationship between value and efficiency in cancer care and what it means when that relationship breaks down. Bladder cancer carries one of the highest lifetime treatment costs of any cancer. Much of that cost is driven not by the disease itself, but by how we respond to it. Delayed diagnosis, fragmented pathways, inadequate support at transition points, and care that does not reflect what matters most to the person with cancer. These are inefficiencies and they have a price. At AllCan, we define efficiency as care that delivers the best possible health outcomes using the human, financial, infrastructural, and technological resources available, with a focus on what really matters to patients and society. By that definition, a great deal of current cancer care, including bladder cancer care, it's not efficient. Not because the clinicians providing it lack commitment or skill, but because the systems around them are not designed to deliver value. In March 2026, Allcan published a major new report, Implementing Person-Centered Cancer Care to Improve Outcomes, Experiences, and Efficiency. It draws on a structured review of global evidence and expert insights from across 11 countries, and it makes the case that person-centered care it's not just an aspirational extra, but a practical route to better outcomes and more resilient systems. The report identifies 7 concrete steps that health system can take covering the full continuum of care, from swift, effective diagnosis and coordinated multidisciplinary care through to digital tools, remote care, communication, and shared decision making, survivorship support, and financial guidance for patients and families. These 7 steps are relevant to bladder cancer specifically. Shared decision making matters enormously in a cancer where treatment choices carry profound implications for quality of life. Supportive care and survivorship approaches are chronically underprovided. Financial toxicity is real and measurable, and the referral pathway, a persistent bottleneck in early detection, is precisely the kind of structural inefficiency that person-centered design can address. The establishment of a bladder cancer patients club within the Croatian League Against Cancer is exactly the kind of structural step that our evidence base supports. Patient organizations that are embedded within national cancer ecosystems do not simply provide support, they generate accountability, they bring lived experience into policy, and they make systems more responsive to what patients actually need. AllCan's Efficiency Hub includes case studies from across Europe and beyond of organizations doing precisely this, connecting advocacy, evidence, and implementation at national level. We would welcome a conversation about how AllCan's resources, including the report and its 7 steps, could be useful to colleagues here as you build this platform. Discussions at this forum all converge on a single question. Are we organizing cancer care in a way that delivers the best possible outcomes for every person who needs it? That question has no simple answer, but it has a direction. The direction is from volume to value, from fragmented pathways to coordinated care, from passive receipt of treatment to genuine participation in it. AllCan stands ready to support that transition through evidence, through partnership, and through the kind of sustained multi-stakeholder engagement that this forum today exemplifies. Thank you.